Okay, everyone, let's look at group therapy. So it's really important to recognize that you, as the group leader, are going to use different techniques for each stage of the group. Um, Obviously, you're going to use a lot of the similar techniques and some of the same techniques through all the different stages, but you're also going to use different ones based on the stage that the group is in. So, this is really important. So, let's look first at the stages. So, we have forming, storming, norming, working, and termination. So during the forming stage, it's so important to help the group members feel comfortable and safe because remember, they're hesitant, they're anxious, they don't know each other. And so you want to take a more active role during this stage and helping them feel safe. And part of that safety is really going over the rules collaboratively. So we're not telling them what to do, but this is a very collaborative process. We also want to talk about confidentiality. Um, Again, this helps them feel safe when they know that what is said in the group remains in the group. We also want to talk about the exclusions to confidentiality. But importantly, we want to have good boundaries as a group leader. Remember, boundaries are critical, and this means that you have to address and identify problems right at the beginning because you're going to see members challenge you at the very beginning. And if you don't have good boundaries, then it's going to affect the entire group process. So remember, good boundaries and setting those, we have to make sure that we set those good boundaries at the very beginning of, for instance, a 12-week session. We want to set them right away. If you have somebody that is a manipulator, well, you're going to have to you're going to make sure that they do not usurp your authority because they will try to do that. Sometimes they try to gain control of the group. They may even struggle with the group leader for control. So it's really just using reframing techniques to help them recognize their behaviors. Even if you have a monopolizer, a lot of times they might engage in productive talk and interfere when others try to speak. This could actually be due to anxiety or even attention seeking. However, it can disrupt the group process. So we want to address that from the beginning. And sometimes all it takes is using redirecting or open-ended questions and even just stopping them. Sometimes if I have somebody that's storytelling, I will put my hand out and say, "Hey, let me back you up. I want to address something that you mentioned." So we can stop them, and we can even direct a question to the entire group. Um, then we might have clients that are resistors. And these are the individuals who resist engaging in the activities and may even get others to resist. So you can address the resistor in one of two ways. You can invite them to participate, but do not force them to do so. Or you can confront and interpret their behavior in a reflective manner. That's usually best done during the working stage of the group. So then you also have silent members. So for the silent member, give the opportunity for the silent member to become more involved. For instance, you might ask the silent member open-ended questions such as, "How do you feel about what Joe just said?" And then show gratitude for the response. We don't want to just jump from their response to somebody else, but it's really about cultivating that environment of engagement. Um, you might also have a client that's sarcastic. We have to recognize a lot of these behaviors are defense mechanisms. So, sarcasm is a defense mechanism. So, help the sarcastic member become able to express the painful feelings directly. This can be done by helping the group member explore the reasons for the sarcasm and where it comes from. and how it was learned. Engage the other group members in the process by asking if others struggle in this area or even with other defense mechanisms. So, then you're going to have the client that wants to focus on others. This is that kind of that caretaker and wants to focus on everybody else's issues. Help them refocus on themselves. In this group stage, in the beginning stage, you can even ask, what would you like to get from the group? So again, it's recognizing these different problem areas that might pop up and knowing how to navigate them. But during this forming stage, we're also going to use joining. Joining is a technique where we help connect the group members, and we can even do this with our icebreakers. I like my icebreakers to be a little more deep than just, what is your name and favorite animal? So, I might ask them something a little more personal. We can also link. Linking is pointing out to others what they have in common. For instance, we might say something like, oh, that's really interesting because Joe said something similar. It seems like y'all really have a lot in common, and both of you struggle with the same issue. So we also want to use cutting off. This is just simply when we stop a group member to prevent a group member from rambling or from being like overly sensitive on a topic right before closing. It just often happens right before closing. So we want to make sure that we don't continue, past the closing time. And so it's knowing how to redirect those topics effectively. So anyway, so let's move to the next stage and some of the techniques in the next stage. Okay, so during the storming stage, what are some counselors' roles and techniques? So during this stage, the counselor is actively listening and encouraging members to actively listen also. Counselors can model and encourage active listening skills. So this ensures that group members truly hear and understand each other's perspectives. So remember, as a group leader, you are modeling the behaviors that you want the group members to demonstrate. So we also encourage open communication. And we do this by creating a safe space where members feel comfortable expressing their thoughts and feelings, even when they differ from others. This is very crucial. Again, we want to continue to establish those clear boundaries and expectations. During the storming stage, members begin to feel a little more comfortable with each other, but they're still apprehensive and even anxious. There's that focus on safety. So we want to continue to create a safe environment where the group members will feel comfortable being vulnerable. So there's a few little conflicts that we might see during this stage, because again, the group members are just starting to get comfortable with each other. They might want to challenge each other. They're recognizing that they have some differences in personality, values, religions, goals. They have conflicting expectations and needs, resisting, new ideas. So we want to really actively listen and engage in conflict resolution. Techniques like mediation and problem solving can be used to address conflicts constructively. We want to reestablish boundaries. If conflict becomes disruptive, the counselor may need to intervene and reestablish those boundaries and remind members of the group's purpose. We also want to foster empathy, and we do this by encouraging the members in perspective taking. Counselors can guide the group members to understand each other's experiences and emotions, and that promotes empathy. We can highlight shared experiences. Pointing out similarities in the experience of group members can help build connections, and it can reduce conflict. So you are likely to see some resistance during this stage. Not more, but some. Because again, during the beginning stages, you're going to see resistance during the forming and the storming stages. Resistance is a subconscious way for a member or members to avoid discomfort, growth, or even conflict. It's going to show up in many ways, and even all throughout the group process, but it's especially common during the storming stage. Um, so, so we have to really kind of be aware of this and recognize the different ways that resistance might show up. So it could show up as band-aiding. This is the misuse of support. It prevents others from expressing their full emotional pain. So you might see a group member, what we call rescuing another member. But it's often, this is important to recognize, so it's often more for the rescuer, the band-aider, than it is for the person that he or she is rescuing. Because of what it does for that one that's band-aiding, it alleviates their own discomfort they have with seeing someone in pain. Okay, so this is really important. Sometimes we really have to point that out. We can even use our open-ended questions and say, tell me how it feels to see your teammate in pain. What is that like for you? So it's that gentle confrontation that we can use, couched as open-ended questions. Okay, then you might have a group member that wants to intellectualize. This is the person that uses logic and abstract responses rather than affect or emotions. So we really want to help them dig deeper, and we can, again, do that by reflecting, by asking open-ended questions that target emotions. Then you might have resistance via questioning. So clients often question the group process to avoid having to focus on feelings. For instance, you might hear a client say, do we really have to share about how we feel? So one way to redirect this type of question is for you or the counselor, as the counselor, just simply ask them to make I statements. Rephrase the question with, do I really have to share how I feel? Because it's about them. And so instead of them saying we statements, redirect them to say I statements. It's okay for, if that's how they're feeling, but that will help them engage in more introspection. Also, you might have that client that wants to give advice. So, just again, we want to redirect that advice. Giving advice, sometimes members that aren't healthy and none of us are healthy. Even the counselor, we shouldn't be giving advice. So remember that counselors do not give advice. We help direct and guide the clients to their own decisions. So then you're going to have dependency. This is the individual who may present themselves as helpless, but refuse to listen to feedback. This behavior actually encourages the advice givers, and band-aiders. And if it's not addressed effectively, the storming stage can have serious consequences for the group. So if we're not addressing this resistance, if we're not seeing this resistance, then some of those consequences are going to show up throughout the group. And this includes a decreased cohesion and decreased unity among the group members. There's going to be a reduction in trust, increased conflict and tension, decreased motivation, poor therapy outcomes. So again, as a group leader, you're just not sitting there in a chair, talking or anything like that. In fact, as the group process continues, you're going to be talking less and less and taking a less directive role. But what you need to be watching out for and addressing early on is the resistance and making sure that you have clear boundaries. So now we've made it to the norming stage. So if you have a 12-week session per se, the norming stage is probably going to fall around, it could be the fourth or fifth session, fourth, fifth, or sixth. So that's about when you start seeing this norming. This is when there's a feeling of oneness, there's cohesion and identity, when members feel like they belong to something larger than themselves. Um, Members actually begin to see themselves more similar than different from one another. They are recognizing their shared experiences. Norming gives group members unspoken guidelines on under which to operate. They are able to gauge how well they're doing as a group and as an event, as an individual. So, during this stage, there's there is just a real sense of belongingness. And there's actually a sense of hope. Members begin to feel a sense of hope that change is possible. They're feeling a little more confident in the group process. There's more cooperation, there's collaboration, members assist one another, there's commitment during this stage. So, some of the counselor techniques during this stage are providing support. Counselors can actually begin to gradually step back and allow the group to take more ownership of their process. So we do less of the talking and more of the listening. We want to promote empathy, help people understand each other's perspectives, encourage self disclosure by creating a safe space that honors people's stories. And we also want to reinforce positive behaviors. For instance, we want to praise that silent member for opening up. Um, and express praise when members show support to one another, even express praise for honoring feelings. So, this is really important because, as we know, praise increases and motivates certain behaviors that we really want them to utilize. Um, do you know, and again, this stage is really about cohesion and continuing to really become vulnerable. The working stage in group therapy is characterized by increased cohesion, trust, and open communication among members, allowing for a focused exploration of issues and productive work towards therapeutic goals. It's the stage where members feel comfortable enough to delve into deeper issues and even experiment with new behaviors and receive and offer feedback. So this is really important. They're starting to feel really safe with one another. Um, so some of the techniques that the counselor wants to use during this stage is to really facilitate and encourage feedback. We want to even teach new skills. We might want to utilize some therapeutic activities such as role play, because again, it's during this working stage that they're feeling safe enough to step outside their comfort zone and to be vulnerable within one another. And so that's when role play is most effective. If we use role play too early, it's not going to be very effective because nobody's comfortable with each other yet. We also, again, want to continue with our open ended questions and our reflections, summarizing and linking, and even some gentle confrontations. So, at this stage, members are really working on their issues, and we want to continue to encourage that, and again, and make sure that our group is flowing without the whole resistance and the conflict and all that kind of stuff. But you will see during the working stage, which is probably about, you'll see that about the sixth, seventh, eighth stage session in a 12-week group. All right, so now we have the termination stage. And this isn't just a one session deal. So if you're having a 12-week group, we want to start preparing for termination probably during the 10th session, maybe even a little earlier, depending on what the group topic is. Um, so the termination session is really tough. Um, this can be very challenging for some group counselors, especially if you don't really honor the process and you don't recognize the difficulty of termination for these members who have really gotten close to one another, and now it's almost like there's a grief process of saying goodbye. So we really want to help the group process those feelings in the group by describing what they have learned, what they've experienced, rather than just going around and sharing the positives. We really want to not, we really want to equip them and make sure that they're ready to use some of these skills in the real world. But the group leader, importantly, again, must focus on separation, grief, and goodbye. Some members are going to have a little bit more difficult time ending therapy than others. And these individuals may need to be referred to individual counseling or even to another group or go through a similar group experience, kind of like recycling. So again, it's a crucial period for processing endings and reflecting on the group experience and preparing for life outside the group. This stage can really just involve a whole range of emotions, including sadness, anxiety, grief, a sense of accomplishment. And so it really requires careful facilitation by the therapist to ensure a positive and meaningful closure for all members. I cannot tell you enough how termination can be really challenging. It can be a psychic shock for some of the group members. And they might kind of regress, and you might see some of that resistance again. They start to regress, they start to even act out. But this is really some of their fears manifesting. So it's about saying, what are you afraid of? Recognizing these behaviors for what they are. And again, help them address these issues. And just getting the clients, getting the group members to talk. Tell me how you're feeling. Tell me what you're afraid of. Because what we see is that the longer the group members have been together, the more difficult this termination phase is. So we might even, during this stage, we might even have like a little goodbye celebration, and really kind of do some sort of ritual, and whatever that might look like. I mean, each group is going to be different, but it's really it's just really important to take these last few sessions, especially the last two, just really seriously, because you want to end on a positive note. So anyway, that is it.